Hi there, my name is June. Today I'm going to show you a demonstration of the assessment of a set of vitals that include temperature, heart rate, respiration rate, two-step blood pressure method, and then I'm going to include height and weight as well. For further, more in-depth understanding and rationales, you can refer to your most current Perry and Potter text. In a second I'm going to have a patient enter the room and I'm going to begin the demonstration for you. Okay.
Good morning.
Well, hello there. How are you today?
Good.
Good, good. My name is June. I'm going to be your nurse today. Can you tell me your full name and date of birth, please?
Jesse Moore, March 1st, 1965.
Okay, and I'm just going to confirm that on your armband. Great. And can you tell me what brings you in here today?
I called for work.
So it's just a checkup?
Just a checkup.
Okay. I'm going to raise the bed just a little bit and then I'm going to ask you a few more questions. Is that okay?
Yep.
So I'm raising the bed to make sure that I have good body mechanics. I don't want to be bending over. I want to be at eye level with my patient. So I'm going to move this table in so that we can work comfortably. At any time you ask any questions you want as well, I'm going to just sanitize this table. Okay, so today I'm going to do a set of vitals on you, and I'm going to do also height and weight. The set of vitals are going to include temperature, heart rate, respiration rate, a two-step blood pressure method, which you may or may not have ever had before, and then we're going to move over to the scale and do some height and weight. Is that okay with you?
Yep, sounds good.
Have you ever had your vitals taken before?
Yep.
You've had your blood pressure done? Do you know a baseline?
No.
Okay, that's okay. Can you tell me if you had anything hot or cold to eat or drink, or smoked any cigarettes or chewed gum in the last 30 minutes?
No.
Okay, great. Have you exercised or had any kind of tobacco products in the last 30 to 60 minutes?
No.
Great, all right. Okay. I wiped all of this equipment down as well before I started, just so that you know. And I'm going to be recording those values as I go. And so I'm going to begin with temperature. So I'm going to put this under your tongue. I'd like you to just close your lips around it, but don't bite, okay? Great, 36.6, that is a perfectly normal temperature. Everything is fine there. Okay, next I'm just going to ask you to please place your hand across your chest and just hold it there. I'm going to take your heart rate next, okay? Okay, great. So I counted his heart rate for 30 seconds and I just didn't say anything to the patient at the time. And then I multiplied by 2 because the heart rate was even and regular. There was no issues there. So you're perfectly acceptable to count a heart rate for 30 seconds and then multiply by 2. Then I counted my patient's respirations without them really being aware that I was. When patients are aware that their respiration rate is being counted, they tend to change the way they breathe. So I just quietly counted those breaths quietly. So patient's heart rate was 72 beats per minute, even and regular. That's how that would be documented. And my respiration rate was 16, even and non-labored. And my temperature, in case I didn't say, was 36.6, and that was degrees Celsius and oral. So that's great. Jesse, everything is fine so far.
Good.
Do you have any
Good.
questions?
No?
Great. We're going to move on now to that blood pressure, okay?
Okay.
So, just bear with me here for a minute while I get everything set up. Just turn it around this way for me. I'm just going to move that sleeve up. So first I'm going to palpate for brachial pulse, and I have it. I'm going to place my blood pressure cuff a couple of centimeters above that, 2.5 to 5. And that's just going to snug up around your arm, Jesse. And you just turn it around like that for me. So the first step of my two-step is I'm going to locate that brachial artery again, and I'm going to go ahead and inflate the cuff until I feel that pulse occlude under my fingertips. That is step one. And that occluded at 120, so I'm going to release the pressure in the cuff. I'm going to wait 30 to 60 seconds just to rest the arm. Then while that's resting, I'm putting my stethoscope in my ears. I'm going to locate that brachial artery one more time. If you have difficulty finding that brachial artery, you can ask your patient to hyperextend their arm, and that'll help it to get a little closer. It's quite deep, so you have to apply some pressure. And then when I have it, I can place my diaphragm over that pulse. Apply some pressure. You want there to be a nice little red ring when you remove the stethoscope. And then ask your patient to relax their arm. I'm going to add 30 millimeters of mercury. So it occluded at 120 millimeters of mercury. I'm going to add 30 millimeters of mercury to that. And I'm going to listen for my first beat. And I heard my first beat rate at 120. And I heard my last beat at 70. So my systolic blood pressure is 120 and my diastolic blood pressure is 70 millimeters of mercury, left arm sitting. And that's exactly how I would document that. Okay. And I'm going to remove that. That wasn't too uncomfortable for you, Jesse, I hope?
No, not at all.
Okay. All right. Fix your sleeve here for you.
Thank you.
And I'm going to move this away. And so now I'm going to go ahead and explain. You go ahead, Jesse, for a second. Bring this in. And I'm going to talk about it a little bit before I bring Jesse back to actually demonstrate height and weight. So first I'm going to discuss height. We generally do our height first with our patient. So we ask our patient to advance towards the scale, remove their shoes, and we help them step on backwards. And if you'll just bring your attention to this bar, I'm going to show you what this looks like for a second so that you can have a better idea of what I'm talking about. So I have my patient step on backwards, so I bring that bar up behind them, and then I raise that black bar above their head, and it sets on the top of their head. When that's sitting there comfortably and resting there, I can then help my patient off. And then if you just look down here, here is the reed mark. So right where that rests on the patient's head is exactly how many centimeters they are tall. So that's all there is to that. I'm going to put that back down. Then I would ask my patient to step back on the scale front ways, and I help them as well. So let's talk about the balance scale for a second. You can see this balance part of it here. Excuse me. You can see that there's two bars that I'm going to be using to weigh Jessie. The first one measures in very large increments. Excuse me, please. The silver is in pounds and the black line is in kilograms, and of course we measure in kilograms. So if you just watch that little dot there, it'll line up nicely. It'll fit in a little groove at 20 kilograms, 40 kilograms, 60, and so on. Excuse me, please. And on top we have single increments. So we have pounds on the top in the silver, and then we have kilograms on the bottom. So this will measure our single kilograms. And when this is balancing perfectly in between that little square, we have our accurate weight. So I'm going to be able to place Jessie on here on the front, and I'm going to be able to turn to come to the back. All of those measurements are also written on the back of the scale. And as I said, it's very important that you zero the scale. That means you bring everything to the zero mark before your patient steps on. So I'm going to have Jessie come back into the scene, into the demonstration, and he's going to take off his shoes and step on backwards, and we're going to carry through with this part of the demonstration, okay? Great, thank you, Jessie. Would you please remove your shoes for me? Great. And would you just turn around for me, Jessie? And I'm going to help you step on that scale backwards, just so you don't lose your balance. And you stand up nice and straight there. And back up just a speck for me. There we go. I'm going to bring that black bar down and let it just rest on the top of Jessie's head. Great. And while it's there, I'm going to take Jessie's hand and help Jessie step down. And I can see that Jessie is exactly 165 centimeters, so I have my height. And now I'm going to move on, and I'm going to take Jessie's hand again and ask him if he'd please step on front weight. I'm just going to move to the back here, and I know that you can't see me, but I'm just going to move the bar. I'm going to start with 60 kilograms on the bottom, and then I'm going to move Jessie is 71 kilograms, 0.1. 71.1 kilograms. So then I'm going to help Jessie back down. And that concludes our demonstration for the day. I would document those vitals, perform some hand hygiene again, ask Jessie if he had any questions or any concerns. And if not, then I would say everything is good and you have a nice day. And thank you very much for your time. And
Thank you very much.
all right,
Have a
thanks.
great day.
Okay.